Welcome to What the Health? Where anything health is fair game as we tackle the trends and bust the myths about health and wellness. Here are your hosts, Dr. Dan and Angela Toro.
And welcome to another episode of What the Health. I am here with my two co-hosts today.
Angela.
And Riley.
Almost doctor.
Almost. Still.
We're like 3 weeks away now.
It'll be Dr. Riley by the time this is out.
That's right. It'll be Dr. Riley. Very good. Very good. Today we are talking about adjusting to AI, artificial intelligence. And you want to give our lovely
our normal disclaimer. So, as you guys know, we're here for informational purposes only, in no way offering individualized medical advice, and definitely offering no recommendations based off this. This is truly today is just us here talking through an article that we found and read, and just trying to keep up on the way the world is quickly going at this point.
I am very interested to see where this conversation goes, because again, it's like we have, unless you did some research in a past life that I don't know about on artificial intelligence, but I know very little about artificial intelligence outside of what it is in movies. You know, you've got I just think of like Jarvis in the Marvel movies with Iron Man, and then of course you had what's his name, Ultron. It took over Jarvis in the one Marvel movie. So, and then I
always go to iRobot.
iRobot is a great example. So artificial intelligence, it's here. I think that's the one thing we can all agree on. It's here, and again, the world is going to have opinions on, is it a good thing, is it a bad thing? And as all things, I think it's probably going to be a little bit of both. There's going to be people who use it for absolute evil, and there's going to be people who hopefully use it for very good. And I hope that's what we can kind of discuss here is what the heck, how is it going to look? It's not what or if, it's how is it going to be implemented into the future of healthcare practices. And since we have a healthcare practice, I thought this would be a great conversation. So, but anyway.
Do you want to reference the article that we're...
Yeah, so the one article we came across, and using it as, again, just a reference point, but it is in BMC Medical Ed, came out in 2023, so I thought that was pretty relevant because it was new, one of the newest articles we found, but it was called Revolutionizing Healthcare, the Role of Artificial Intelligence in Clinical Practice. So we just kind of used this as a bullet point. We wanted to reference a couple things on there, but at the end of the day, I think artificial intelligence is going to be great for a lot of things, like we talk about decreasing error, being able to read massive amounts of data, going through points. That's the one thing the article talked about was, AI programs being able to read things like X-ray, mammography, chest X-rays, and being able to, analyze and come up with a better diagnosis than even some of the best radiologists. So,
and more quickly as well. I mean, that's the other thing is just, if anyone's had to wait on a radiology report recently, you could be waiting a couple weeks to hear back. And, so just, knowing that people are getting results more quickly, more accurately, and with the potential of, less of the false positives or false negatives, because that's huge with these tests. We talk about it all the time with, the quote unquote early detection tests. It's again, there's pros and cons to them because the rate of false positives can cause a lot of issues as well. So if we can cut down on that, and really, increase the benefits of catching things early, and then just again, it's the direction that where do we go from there once we're catching these things early.
And that's a fantastic point, because that's reading the article. The article was very much wrapped around medicine, right? And again, it's like, we're looking at this from a healthcare approach. And the one thing I did
But we consider healthcare.
Well, and again, that's right. When we consider healthcare, medicine, we still argue and maintain is not healthcare.
Yeah,
it's sick care intervention. And it has an absolute place. And I think it's actually gotten significantly better with the advancement of a lot of immunotherapy drugs for cancer treatment. It's gotten more targeted. In fact, there was a whole section in there that talked about the
targeted treatment,
precision medicine they call it. And I'm like, well, that's exactly what we do. We don't do medicine, but we do precision customized healthcare. I mean, that's one of our core values, because we understand that everybody is a little bit different. So we're taking into account those differences. And so, from our perspective, I looked at it like, how much cooler would it be that we're able to look at stuff like that and do it at an even deeper level to really customize, come up with a customized approach. Now, again, time-wise, that's difficult to do on a mass scale, but something like AI could be able to really help us, help us dive deeper into that. Like, we had friends over this weekend, right? And they were talking about their sugar monitors that they were wearing. I think that's a beautiful example from a biomarker perspective. So that's a sugar
continuous glucose.
Yeah, continuous glucose monitor. That's just a patch that you wear, and it goes directly to your phone, and it's basically kind of monitoring the sugar throughout your day, and specifically trying to see how different meals, what you're eating, is impacting it. And then alerting you to say, hey, you're on a quick upscale. You could do this in terms of like a walking or a squatting, or trying to get your activity up to help curb that sugar spike. So that's a direct biointervention from an artificial intelligence perspective that I think is kind of like the future of where we're headed. Because rather than wait until you get sick, right? Wait until you have insulin resistance, and needing to, or having a doctor wanting to put you on medication. Now you're able to help curb that before it ever gets there.
Yeah, and I thought one of the cool things I talked about in the article too was because again, I didn't really realize how much stuff was already being used, or where they're trying to go with things. But yeah, monitoring vitals and things like that. So again, blood sugar is one of those, but blood pressure, heart rate,
heart rate variability,
all of these things, and again, the ability for people to be able to do that from home, and then it's being connected to their healthcare professional. So again, but they're getting feedback in real time. Yeah. So instead of I've personally have had to wear a heart rate monitor for 14 weeks or for 14 days, and you send it in, and then however long until you hear back. It's like, versus if that was something
who didn't have a heart attack in there, right?
Yeah, exactly. It's like, okay, so obviously I didn't die, so I mean, there's that, but you're waiting to hear. So as opposed to if something like that, I see that as something being that AI would be involved with, where you're getting real time, hey, you just had a spike or an abnormality. What were you doing? What, and again, being able to track all that, I just think that's gonna, really add to, again, some of the precisions of that, as opposed to, a month later you're getting those results and they're like, oh, at this time on this day you had an abnormality. Do you remember what you were doing?
Yeah, right.
You're supposed to log everything while you're wearing those, but who's sitting there? You're going through life. You're not thinking you did something that was quote unquote episodic.
Yeah.
So it's just things like that. I feel like that kind of came to mind just as something where, again, it could be really beneficial getting that real time. Hey, your heart rate's, and a lot of the smartwatches and stuff are kind of doing them now. Your heart rate's going up. Maybe you need to do some deep breathing. Maybe you need to
get off the treadmill.
It's like, are you exercising? No, you're sitting at work. Okay, maybe you need to take a breath. Step away from whatever you're working on. Step away from the children. But so I think in that way there could be a lot of positive benefits of it. And as far as what we're looking at, which is, again, using lifestyle interventions
to be able to show that. And again, I think it's going to help to prove and show that, right? Because even we talked a little bit about mental health care and different medication interventions, and again, it's like, what can we do? We know how much exercise increases, certain hormones that just, really elevate your mood. And it's like, to be able to show that in real time, would just be, again, so beneficial, because then it's like, again, look, this activity stimulated this. And if you can, it's like the Pavlovian dog thing, right? Yeah. It's like, hey, this increased your mood. So let's, try and, continue that pattern and increase that, pattern of behavior. I think it can really help people through some really difficult situations.
Yeah. See the things that we don't necessarily see right away. But, I do. I thought another part that was really interesting. They talked about, using AI for patient education. Yeah. And I know that's something that, we're really big on, is making sure people understand, it's not just, okay, come in and do what we say. We want to, show people why, here's the changes you're getting. This is, why you're feeling better or not feeling better, or, again, really making sure people understand the process. Yeah. And at first that's something where I thought, I was like, well, before reading the article, I was kind of thinking, AI is going to take away from the personal aspect of that. But again, they're talking about, AI has come such a long way. And, again, they're talking about it's interactive, and it's, it's, they're able to, put things at different reading levels or different languages. Yeah. So again, we've had language barrier issues with some patients. Patients are coming in with their mother or spouse because they don't speak English well or at all to the point. So again, having that where you can really bridge some of those, we talk about all the time, all this makes sense to us, but we forget that not everybody did, 4 years of undergrad and X many years and, post undergrad education where these things just make sense to them. And, so it's just, having that, kind of having that ability to have that, at least do like the front, a portion of it where you get that. And the part that really jumped out to me when they were talking about just, again, some of the messages that you're giving on a daily basis that can become kind of monotonous. Again, the AI is always going to have the same level of enthusiasm, and AI is not going to have a bad day. AI is not dealing with, I didn't sleep enough, or I just can't say this message for the millionth time. So it's always going to kind of have that same level of, talking about
delivery.
It's like, I can only tell you so many times to stop eating the junk and go exercise. Put the cookie down and go for a walk.
Maybe it needs to do that.
Yeah, maybe.
This is now the 10th time that I've told you today.
Maybe it will. I don't know. Maybe I will have an attitude. I don't know. I
know. Hasn't that happened in something like the Siri or like Alexa?
I do sometimes.
You can get some.
Sometimes I feel. There are some times where I'm like, Alexa, you kind of get an attitude with me. I'm not liking your tone.
Some people are hard-headed, so you just, feed them some sass.
Maybe they do feed off of it.
That's right. But, that's another great point, is like, is AI going to be able to start, again, it already starts to recognize our patterns of behavior, right? So like autocorrect, or, hey, we're talking around our phone and now all of a sudden we're getting, advertisements for, this, you talked about this. And it's like, what the heck? Stop listening to me. So in another way, you start to wonder, it's going to be able to, look at, again, personalization based on your environment, your lifestyle, your biomarkers. But my question is it going to take into account our belief systems? Because how much someone, who has like a Christian background, or, a Muslim background, or, is atheist. It's like, do those belief systems come into account? Because, I back it up a step further. It's like, even AI, to a point, at least in the beginning, is responding to, the data that it's getting, right? So again, just coming at it from this whole perspective of medicine, medicine's, belief system is, hey, you have this, this what we consider dysfunction or, dysregulation. We're going to treat it, right? It's something is too high or too low outside the normal range. So we want to treat it with, a drug, a surgery, some sort of intervention to bring it back into that normal range. But asking AI specific questions or giving it data around that, I would say someone who has a very medical background versus someone like us who has a very, health-oriented background, behavior-oriented background, and how do we, establish that so that we don't need the medical intervention as much. I think if you ask those questions, you ask the same question it's going to be answered differently, right? So, I just wonder again. I don't know the answer, but that comes to my mind. It's is that going to be taken into account, or could that? I'm sure it could be, but is that something that's taken into account as we move forward?
Yeah, I think it's really dependent. Angela and I talked about this yesterday, based on what data is put into the software. You can hopefully rule out biases based on what goes in, but at the end of the day, if you have a medicalized AI, they're not going to get that holistic approach in there, and that could alter the AI's belief systems as well.
Well, and that's just it. I mean, going back to the Age of Ultron example, it's he did all that. If you haven't seen the movie, you need to go watch Age of Ultron and Marvel, and I don't get paid for that. but again, it's when the new AI was created, he went and he was analyzing all the data, and he got to it's he was trying to figure out what is the goal, what is my purpose. The AI was trying to figure out what is my purpose, and he came across Peace in Our Time, and it was a clip from Iron Man saying, peace in our time. And so he was so set on trying to accomplish that. Well, his only way he determined that all the Marvel heroes were the ones causing all the destruction. Yeah. So then, he was so targeted on destroying all the heroes in the movie because of that. And it's if you get a belief system into an artificial intelligence, like a medicalized belief system into an artificial intelligence, well, that's going to skew, its output, right? And that's, you go back to the simplest answer Tony Robbins always said, the quality of our life is dictated by the quality of our questions. Okay. So how we are asking something, someone has high blood pressure. Do we lower it with artificial, medication, or do we try and change, the lifestyle, the underlying reasons of why the blood pressure is high? Do we have to change our work environment? Do we have to, implement some deep breathing? Do we have to get adjusted? So all those underlying factors. But if that question is never asked, then you're automatically going to go to, the research and going to go to, and again, what's been most researched? Medication has been researched over the last, 100 years. I mean, that's what it's been. It's you have this disease, take this medication, and it's very, very linear. So, I think some of the positivity that comes out of that is, maybe it does start to broaden our horizon. Maybe it looks at interactions a little bit better.
Yeah, that's what it's, and even, from the medication standpoint, because at first when I started reading, it's this is just going to be, one more way to to push medications, because it's, okay, we're going to track, people have X, Y, and Z, so put them on this med. But they did even talk about one of the things it can be used for is better tracking post-trial adverse events and trying to, lower that. Because again, when people don't realize, or again, people who don't have a research background don't realize, when people talk about, things that have been clinically tested, that's in a very controlled, randomized situation. So these people are literally, I know somebody who used to work in drug testing. I mean, these people were literally kept, in a room, put on this drug, watched, monitored. They're controlled for, they're weeded out if they're on any medications, if they're a smoker, so basically you're taking super healthy people and putting them on this medication to just basically see what happens to them. That's how you get that long list of adverse events. If one person passes out, that goes on as a possibility. If one person, gets a headache, that goes on as a possibility. So it's trying to figure out what would this do to a healthy person, and then it gets tested in the actual population. Yeah. So there's this whole things that it needs to go through. But when you take that and then you put it into somebody who actually is sick out in the real world it's just there's no controlling for what's going to happen, and so that's where again you'll see. The people that get really sick or have interactions with things you didn't know you were going to have an interaction with. So there's still so many unknowns when you're taking those medications, because it's just, again, they were tested in a very controlled environment, and now you're taking it out in the real world where, you can't control. You can tell somebody not to smoke and drink alcohol while they're taking this medication, but are they going to listen to you?
Yeah, exactly.
And again, maybe that's something where, if that's something AI monitors, like, hey, you're on a medication and we noticed that you're, there's no nicotine in your system. You're not supposed to, that's a potential interaction. There's alcohol in your system. That's a potential interaction. So if people can, again, get that, again, at the end of the day, people are going to do what they're going to do.
Yeah.
But if that helps, cut down on some of those things by, again, increasing the education for people or helping them really reinforce the seriousness of some of those things, because it can be really overwhelming when, you're at an appointment and they say, okay, but here's what you need to do or not do. Okay. see you in a year or see you in 6 months. And then all of a sudden you're like, well, how serious were they about that? So again, if it can help cut down on some of those adverse events that happen, or again, cut down on unnecessary. Yeah, exactly. Okay,
so
maybe
we're talking about dose optimization.
Like the antibiotic, specifying. I know we're trying to be better about that, but I think there's still just so much of okay, we'll start with this one, see if it works. If it doesn't work, go to this one, go to this one. I mean, I've been through that myself. And versus, oh no, based off what you have, this is, and your background and how you've responded to things in the past, this is your best chance of.
And it's even something like analyzing a microbiome, if it's possible to do that. It's based on this, maybe we need this targeted. So it's almost like a customized, it's almost like a customized drug, based off, the concentration of, what's going on in your system at the time. It's a lot of, and again, the article did say, I mean, there's still so many things that need, again, cybersecurity continues to be a huge issue and huge concern. And then just I kept laughing because I underlined, they're the big thing is that the, scientific world needs to work with the medical professionals and they need to work together. I was like, that seems like two interesting groups to put together because, again, you have scientists that are so data-driven. Yeah. And then, ultimately you're going to need health professionals in there that are patient-oriented and people-oriented. And I'm like, oh, good. Try to get those two groups to work together, because at the end of the day, like you said, it's all what you put into it. I don't want people that only think data and numbers creating how these things work, because we know as, I would say, again, going into the line of work that we go into, we're much more highly empathetic. We're much more people oriented and driven. So it's I don't always necessarily care what the numbers say. There has to be that what makes us human is that we can connect, we can feel energies, we can connect with people.
Numbers don't walk into the office.
Exactly.
Patients, so.
And you can sense, you can sense somebody the second they walk in the door, what kind of mood they're in, what kind of energy they have, and that can totally impact how they respond to, to what you're telling them, to how their adjustment goes, how their day goes. And
we've had those people that are just so, they're in such a bad mood, or maybe that's just their general demeanor, and it's they've already made up their decision about your process, and but they're there because their wife told them to come in, or a neighbor is they told me to see, but
their
it's
daughter.
I was thinking about
yesterday.
But they're there because they were told by a family member, a friend, but they have absolutely no interest in being there. So that all needs to be taken into account, like you said. And then again, going back to something you just said earlier in terms of the science and the cybersecurity side of things. Now we're getting into a whole level of Big Brother, right? Mm-hmm. The whole idea of, who gets this information?
Who controls this?
Because, I could see it when we've had these conversations before, about universal health care, right? I don't believe that we should have universal health care based on how it is right now, right? Because, universal healthcare right now is defined as, you get all these different services, but I personally don't think that, cancer treatment or, maybe like even heart attack intervention, and again, those are ethical questions that we have to ask. But now you start bringing in something like an AI that has tracked your, behaviors over the past 5-10 years. And they realize, well, wait, you have, you've been consuming alcohol on a daily basis. You've been smoking on a daily basis. Who or why should we do an intervention? Those are the type, and again, I'm just bringing this up as a for instance, but do you even do the intervention? But that's taking it to like a whole, like the end of the line, like ethical question, do we treat you or not treat you? But, taking it a step before that is like, what's your cost? Do you start getting charged more, for, your tax more? If we had universal health care, right, it would be a tax. So do you start getting taxed more on an individual level based on your patterns of behavior? Because again, it's very well proven and documented that there are, lifestyle factors that lead to, more cancer, more heart disease, more diabetes. Like those are all lifestyle factors that lead to that. So if they're able to track over, 5, 10, 15, 20-year time frame what your behaviors have been, now do you start getting taxed more? Do you have to start paying more into the pot because of those behaviors? I'm not it's way above my pay grade, but that's a question that we have to look at. And again, that's why I don't necessarily agree with universal health care, because again, it's not individualized. It's here's the stamp, here's the one size fits all. If we could start leading towards more of an individualized, plan and talk about what that may look like, maybe I'd be more open to it. But I think
that was the other interesting thing the article mentioned with the AI is with some of these home interventions can actually cut down on emergency department visits.
Absolutely.
And I think that's huge because I think that is such a
drain.
A huge cost, especially in our country, because again, people who don't have insurance, don't have a PCP, don't have a first line to go. So that is their first line. That's where they go for everything. A sniffle or if their arm got chopped off. Which one of those you should go to the emergency room, just to be clear. But
your arm's off.
Yeah, just a flesh wound. Have you seen that movie? No, we'd already.
No,
you haven't.
Oh my gosh, you're so young.
But anyway, being able to cut down on that, making sure people who don't need to, or people who do need to go. I mean, I think about like the stubborn men that our cousin used to work in triage and, as a nurse, and I remember telling the story, like the number of times that she would answer the phone and the person would be like, well, sounds like you're having a heart attack. It's like, okay, I'll drive. No, you hang up the phone, you call 911, and they take you to the hospital. You do not get behind the wheel of a car.
Yeah, have a heart attack or stroke kill someone else.
Yeah, and cause a 15-car pileup. So again, if it's like if we can do a better job of getting people who need to be there and keeping people who don't need to be there. And they're kind of already going that way a little bit with some of the telehealth and things like that. Yeah. But again, if AI can step in, because we know healthcare workers are just overwhelmed.
Absolutely. And again, a lot of it is because we are so sick, right? We just have very poor, we have poor, and again, we can call it a choice or not, but again, our food supply, we talked about this and so many other things. It's like our food supply options are so limited and terrible in this country.
Our water quality, our air quality.
Water quality, air quality. I mean, those are the environmental factors that a lot of them we don't have control over. Now again, we have control over our lifestyle, the choices that we make, whether or not we do choose organic or, not. But again, sometimes even people don't have access to organic fruits and vegetables and meats. So, that comes into effect as well. So, but I think at the end of the day, the coolest blend I can see is, you have an AI that is available on the on the like personal, we took going back to that glucose monitor, that continuous glucose monitor. And, and again, there's going to be more biomarkers that are going to be able to be measured. Again, even like my Fitbit watch, it's like it measures heart rate variability. It measures my sleep. It measures, again, now how accurate some of that stuff is, but it's data, right? So it at least gives me something to go off of. And then I can track like, well, wait a minute, what was I doing leading up to that? So it's like, I have it as a personal use. And you even have an AI, like you mentioned, with the patient education side of things. Like, you know, hey, what does this mean? It's like you have an AI that could literally pop up with a whole, 15-minute, presentation, or 5 or attention span. Now. I heard our attention span in the United States is like less than 90 seconds. It's disgusting. That. And here we are doing a podcast for over 30 minutes so far.
So for the 2 people that are still listening.
Thank you. But it's like you have... But you have all of that for personal use. And then if I feel, if I'm feeling ill or something, comes up, rather than all of that information being monitored by a central system, I would have a choice to say, okay, let me plug into this AI or, this local emergency department or, this community, healthcare organization. Let me now choose to send them my data, or have the AI analyze it and, communicate. And now that AI can be, working in conjunction with a person, like myself, Dr. Riley, or you. And now we can use the AI to gather, interpret all that data, and then come up with a decision on what to do. But again, it's at the, request of the individual rather than constant monitoring,
that I think that'll be interesting. Again, that's going to be
that's a whole big ethical privacy discussion.
That was the big conversation that came out when genetic testing started becoming a thing. Which again, that was my big thing reading through a lot of this. Is a lot of the capabilities that AI will be able to do is going to be dependent on genetic testing, because again, they're talking about a lot of having that, and again, having that done before you're sick, because they need to have that information available to figure out what medication might be best and all of that. So I've always been a little weird about that, just personally. Sure. Just because again, I remember learning about that. I mean, that was a lot of what I studied back in undergrad, taking ethics classes. And again, those same questions. It's like, if somebody gets to the point that they're sick and now you have their entire genome on it, you can go back and be like, oh, well, you have, it was because of this. It's not worth treating you or something, Again, and I'm not saying that's happening, but there's that potential when you have, how much information do you want to give? And where does it go? And who has it? And how is it going to be used? And it's just, and now you're talking about putting that in conjunction with AI. And it's, it is. It's kind of like, okay, well, who has access to this? Is this, you go to try to get, disability insurance or life insurance, and all of a sudden it's like, oh no, you have this genetic marker and we see that you do X, Y, and Z in your daily life, so nope. Yeah. And it's like, okay. So it's just, it's kind of, because again, I don't think anybody's perfect. I mean, I consider myself a healthy individual, but I still know I'm sure there's things where if you just plug it into a computer, it could easily go, nope. So I actually had that happen recently. I just got denied for disability insurance because of something. And that was the other part I found scary, because again, you're relying on health records being accurate, which I know mine are not. I mean, I've been with UPMC for years, and I look back I'm like, that's not true. I'm like, so now you're talking about an AI system having access to anything that has ever been input on you, and doing its calculations, and are you a high risk, low risk for whatever? And so I'm just like, I'm not crazy about that idea personally, because
I agree. Again, you're looking at the risk, right? You're looking at, which is all predictive, right? It's like, you could have a very high risk of cancer, heart attack, stroke, but you may never have one.
Then we see the athletes that
that's right. Someone who you would never expect to drop dead of a heart attack, in their 20s, at the peak of their career. It happens.
So it's just, but again, you start talking about, and that's the individualized of it. Like you start putting playing the numbers game, though, then somebody who could benefit from an intervention might be denied it because of the numbers don't, it's like you said, it's not numbers that are walking in the office. It's a human being who it has value to them, their life. So, we we don't get to sit there and play, play maker. It's we're here to help people the best that we can, and it's deciding if somebody's a good person or bad person or decides to live or not. I don't personally think that's for anybody anybody that decides. So it's a scary thought of just having that. Plus, I just say, it's like, does anybody ever watch these movies? Like, the AI always goes evil. Like, do we know? I just say that?
Matrix,
like, right? I'm like, have we ever seen, like, and They All Live Happily Ever After AI movie? Like, I'm just saying. Like,
I feel like the outcome was okay at the end of iRobot.
They had to destroy the central system because she overtook all the robots.
but there was like one or two that was left over.
Yeah, Sunny saved the day.
Sorry if we just ruined it for you if you've never seen.
Oh my god, you haven't seen that movie. You had plenty of years. But it does. It's just and like you said, I mean, I know personally this is not at all my realm or area of expertise or interest even. So it does. It gets scary when you just start hearing all this stuff and you're like, okay, well, great, robots are just going to control everything. So, which is where my mind goes. I realize that's not exactly how it's going to play out, but it is. It's,
at least not in our lifetime. It's coming.
I know it's coming. It's coming fast though. So it's just. But it is. I do think this was interesting. I appreciate you having us read this article, finding and having us read this article, because it's definitely more than I would have delved into it on my own. And
it just gets us thinking, and again, taking it back to really, what is our use with it, again, because we're not going to be making ethical decisions about, we're going to, see and help any person who walks into our office the best that we can. But, even something like, reading an motion x-ray, could it get to the point of like, okay, here's the program, boom, they're all the way in flexion, head down, and it's like, boom, and they pop up all the angles for us, and could we see like before and after, percent changes, like that's the kind of stuff. Pre-post, you talked about area under the curve, yesterday with the, infrared thermal scan.
Stuff,
so
can it analyze the patterns?
Yeah, can it analyze the patterns and percent change in those patterns? And yes, that's all stuff.
And give it to you immediately. Yeah,
it's like boom, it pops.
Like you guys are looking at it and kind of quickly.
Yeah, we're making a quick clinical decision, but you're right. It's like we can't,
Like it could go back and look at all of them and see that. Yeah. So that,
well, and that and then even being able to pick out a pattern too, like it's like
kind of like how I for training, because I'll hear you say to him, based off what you see on the thermal scan, make sure you check their T1 or make sure you check the the Atlas or whatever. So like if you have the program actually doing that, and then it becomes an education tool for future interns and
Dr. Dan AI. Hey,
exactly. We should definitely have it in your voice.
We don't need two Dr. Dans.
Aaron has already.
I'll be on vacation.
Aaron has already said that neither one of us can be cloned. She cannot handle any more turtles.
Well, if you keep letting Dr. Riley hang out with us, he's gonna. What do they call that? The hive, the hive brain, and we're all plugged in.
No.
Man.
No, definitely, it's definitely interesting. It was a good article. Yeah, I mean, it was a review article, so I thought it was really well laid out as far as kind of the different areas of healthcare that have that potential. So yeah, if anybody is in the healthcare or not, and just is interested in the way, the way we're kind of moving.
Yeah, we'll put the link in the podcast notes underneath. But again, it's revolutionizing healthcare, the role of artificial intelligence in clinical practice. That was out of BMC Medical Ed 2023. And then again, this was just a lot of our, understandings and just, lack of understanding and just discussions
open, honest discussion.
Yeah, our thoughts about adjusting to artificial intelligence in the clinical role. So if any of that interested you or you have more questions, don't ask us about AI, but we're happy.
Or if you have any other references, like if you've seen a good article or something, that we're always like to hear what other people are seeing and reading and and following. So absolutely.
So with that being said, I am Dr. Dan.
I'm Dr. Riley.
Angela.
And we will see you on the next What the Health podcast. Thanks so much, everyone.
Thanks, guys.
You've been listening to What the Health with Dr. Dan and Angela Toro, brought to you by Toro Family Chiropractic. To learn more about the resources mentioned on today's show or listen to past episodes, visit www.whatthehealth.world.